reports coming from the presidency this morning is that the president has granted some form of waiver for select hospitals. Let's just take a listen. Dialysis, kidney dialysis in government hospitals before now used to be 50,000 naira. That's like a day session. But the president said he will pay the subsidy and victims will only pay 12,000 naira. But there are select institutions, it's not all the government hospitals. So, FCT Butameta, that should be for Southwest, there's in Lagos, Jabi for Abuja, Abeokuta also from the Southwest, Owerri, that's the Federal Medical Center Owerri for Southeast, UCH, Unimed, UBTH, Benin, UCTH, Calabar, Lut, Abakatafa Balewa Teaching Hospital, Bauchi. So these are the select hospitals where you go for kidney dialysis and pay just 12,000 naira instead of the usual 50,000 naira currently paid.
Well, on the surface of it, I think it's a good move. But Nigeria is ripe enough to have specialist hospitals, and in the real sense of it. Elsewhere in the world, yes, there are specific ailments, particularly for the aged, that are subsidized seriously. Some of these policies for me are just populist policies. If you look at the divide so far, from what you read, we have about 3 in the southwest alone. And then you look at Bauchi, you look at Maiduguri, the northeast is very vast, for instance, and you have only 1 in Unimed. Now the question is, what is the distance of the Federal Medical Center in Ebutemeta to Abeokuta and the other one in Ibadan? Now you have 3 of them in the southwest. How vast is the southwest? And so this will bring about more agitation, more controversies as to why a region is having as much as 3 and others are having 1. In the south-south, there is Calabar. And the south-south comprises of Edo, Delta, Rivers, Akwa Ibom and all that. 6 states. Owerri alone for the entire southeast. You begin to wonder. So maybe with time they'll begin to add up to them based on the facilities on ground. But can we say beyond these rather populist tendencies that we can begin to see a situation where government truly build specialist centers? We're supposed to have one in Erua in Edo State. And that is one that, if you recall, during the pandemic, people had to be taken and the samples had to be taken from distances to the place. And anything could happen. So how could you get authentic results? But in any case, it has been done, it's been done. We are in a place where governance is not inclusive, so to say. Otherwise, this kind of thing should not be, something that is coming straight from the presidency. It should be subjected to some form of contributions, even from the National Assembly, so that we can see the spread being properly done. Now, we look at the North Central region or the Middle Belt, if you like. Is it that in the calculation, all of that place is not mentioned, it's not supposed to be? Jos, for instance, has UJTH, but let's see how far it goes. But these questions will be asked in the long run.
I'm trying to know where Azare. Okay, that's in Bauchi. Okay, and we move now. But if I will advise, I think we should focus on taking care of our health. Prevention is better than cure. What are those things you take that jeopardizes or risk your kidney? Take care of yourself so you won't have to look for a specialist hospital where they'll be asking you to pay 12,000 naira, and then the queue will be so long, the facilities cannot go round. Take a lot of water, mind what you drink, especially all those of you who like to drink all this local mix that some women share around. You don't know what it is made up of. Agbo, I don't know what they call it in Igbo. Those local herbs that they tell you that is for one sickness or the other. You don't know what it's made of. You just swallow and then put your kidney at risk. It's I think for me that's the part I would rather focus on. I would rather not bring a kidney ailment close to me than look for solution.